Welcome to the Medical Staff Voice Live. I'm Dr. Stan Frosway, Chief Medical Officer at Community Memorial Health System, and I'm joined today by Dr. Thomas Fogel, Radiation Oncology. Welcome, Dr. Fogel.
Thank you.
My pleasure. This is a great opportunity for our medical community and our public community to learn more about you and your practice. In order to do so, we have a few questions that will help enlighten us and give us a better idea of what it is that your specialty entails. So first question, tell me a little bit about yourself, where are you from, what brought you to Ventura, and a little bit about your training as well.
So I grew up in New Jersey and spent 12 years between upstate New York and New England, medical school in Albany, New York, and then internal medicine residency in Providence at one of the Brown University hospitals, and then 3 years of radiation oncology residency at Yale. Throughout all of those moves, my wife kept saying, "When are we moving to California?" And I kept saying, "We'll do that next." Well, I stalled long enough and we ended up in California, and fortunately we ended up here in the Central Coast and in Ventura, and I've been here for 37 years.
My God, that is wonderful, but I can identify with that. So the motivation for you coming here is the same motivation for many physicians. Their wife wanted to come to, or their spouse wanted to come to Ventura or California.
Well, I can't complain. I mean, it's hard to find a better place to live, and it happens to be a fantastic place to practice medicine.
I couldn't agree more. Thank you. What we really would like to understand is, what is a radiation oncologist? What does a radiation oncologist do? How do they integrate with the rest of the cancer treatment team?
Radiation oncologists manage patients with cancer. That's the bottom line. Just like the other oncology disciplines, medical oncology, surgical oncology, gynecologic oncology, we deal with patients with cancer all day, or predominantly cancer. There are actually a few benign diseases that we treat as well. We happen to use radiation therapy as our treatment modality. I often get this question from residents and medical students because fortunately many of them do rotate through oncology and spend time with us, and they're surprised by the fact that we spend most of our time seeing patients, not sitting in front of a computer or looking at x-rays. We do spend a lot of time looking at x-rays because that is the technique that we use, that's the technology that we employ to treat patients. But the average day, we see consultations and follow up patients and treat and manage the patients who are undergoing radiation as their treatment.
Thank you. That makes a lot of sense. Most people have heard about all sorts of new radiation therapy advancements. They go to either one of the tertiary care centers or they find a location elsewhere of all kinds of, what do they call them, the saber knife or all those. Can you explain what do you do in reference to those? When do you refer outside of our local community, or do you even do that?
We're fortunate enough here in Ventura to have state-of-the-art technology. So most patients can be treated close to home and not have to go to another facility to get something done. There are some patients who require something special, either a modality that we don't have locally or a certain level of expertise that we don't have locally. Now, why would that be the case? And generally it's because it's something rare. I tell patients, if you need a tonsillectomy, you tend not to go to the professor at UCLA because they never do tonsillectomies.
Very well said.
But for that unusual case, the experts see all of the patients in Southern California. And that holds true in our discipline as well. There was a time when I did everything. But as the technology advances, as the specialty advances, the rare stuff should be handled by the person who does it every day. The common stuff, And we see the common things all the time: breast cancer, lung cancer, prostate cancer, colorectal cancer, melanomas, skin cancers, and the like. Those are treated on a daily basis and regularly. And fortunately, we have state-of-the-art technology. As I said, we have a brand new linear accelerator that we just installed 9 months ago. And we're still exploring all the bells and whistles that come with it. I tell people that the advances in our discipline, much like the advances in a lot of disciplines, have exploded because of computers, because of the speed with which things are communicated, and the ability for us to deliver treatment in a precision manner.
That precision manner is brought up quite a bit, and I know you deal with that.
We do. I mean, we treat, for example, one of the advances is the early detection of lung cancer. And as you know, patients who have a significant tobacco history are now being offered lung cancer screening with low-dose CAT scans. We are finding early lung cancer years before it would progress to the point where it is no longer curable. And early lung cancer has an 85% cure rate. But not all of these people are eligible for surgery. And for people who have underlying lung disease, emphysema, or their age precludes the kind of operation they would require, we have the ability to pinpoint radiation and do what's called ablative treatment. 3 to 5 treatments, not 3 weeks, not 5 weeks, not 9 weeks, 3 to 5 treatments, destroy the tumor with no damage to the surrounding lung. Because we have the ability to target those things so accurately and monitor that targeting to know that we're precise, it's completely non-invasive. And it has about an 85 to 90% control rate.
Wow. That's so important for our colleagues and the community to understand and appreciate. What ages do you treat?
Well, we generally don't treat pediatric patients. There is a pediatric oncologist at Ventura County Medical Center, and once in a blue moon we will see an adolescent that we'll treat. But pediatric radiation oncology is one of those specialties that really requires not only the understanding of the disease and its treatment, but an immense surrounding supportive environment that we simply don't have here locally in the community. And for those patients, they'll go down to Children's Hospital in LA or Orange County or elsewhere, for that kind of specialty treatment. But other than that, we treat everybody. I remember I saw not long ago a woman who was 100 years old, and I had treated her 25 years ago, and her first comment to me was that I'd gotten old.
And she was correct. We're all getting older, thank goodness. Well, I appreciate your clarification because it's important for people to know, for referral purposes, where to go with that. Where is your practice located?
So we're located across the street from the hospital. It's called Coastal Communities Cancer Center. It was constructed about 14 years ago, I would guess,
right,
when the new hospital was being built. When we were very fortunate to have had the cooperation of the hospital in building the cancer center, which houses the radiation center as well as medical oncology, gynecologic oncology, Grossman imaging centers, PET-CT for diagnostic purposes, and also our cancer resource center. So it's really a comprehensive center, and it sits kind of smack dab between the two main hospitals here in Ventura, which is nice because we serve a larger community than just CMH.
Yes, you are a community service. Thank you. So we're going to transition a little bit to some lighter topics. First of all, do you have any outside interests or hobbies or activity endeavors other than collecting pens that we don't know about?
Well, you mentioned the pens. I'm always looking for vintage fountain pens and writing instruments, so all of you can call me for that. But, I'm a musician. I play in a old guy rock and roll band. In fact, a few years ago, we were featured in the Star. There was an article about old guy rock and roll bands, in fact. And So,
Which instrument?
I'm the lead guitarist. I do my share of messing up, but it's actually a lot of fun. We got together as a band when our kids were in middle school. The music teacher at middle school asked a few of the parents if they would help out with a program. And we've stayed together ever since. And just to give you an idea, that middle schooler of mine is now 40 with 3 kids. So we've been doing this for a long time.
A few years now.
Yeah.
Very good. Well, thanks for that insight. It really helps us figure out that rounded person that you really are.
And I just want to add one
Please.
thing. For the doctors who are listening, we have an open house coming up on November 9th from 5 to 7. And I would be happy to have anybody come. We're going to be showing off some of the equipment, some of the technology, some of the things we do that frankly we're the only ones who do between Santa Barbara and LA, well, Thousand Oaks, where we also have the same equipment. We do some very specialized protective kinds of mechanisms to avoid problems from treatment, specifically for breast cancer and prostate cancer, which are really our 2 most common diseases in men and women. And it's really pretty spectacular.
Thank you for telling me that. Please make sure that Tracy Shoup has that information. So I have a few other questions, but this goes to the lightest and most enjoyable part for me of this conversation. And it's really kind of a stream of consciousness response. So you're going to get the this or that questions.
Okay.
Early bird or night owl?
Night owl.
I find that's very consistent with creative and artistic individuals.
Well, fortunately for me, my partner, Jeff Rodnick, is an early bird.
So you complement one another. How perfect.
Yeah.
And I know him as well. French fries or onion rings?
That's a tough one. I happen to like a lot of fried food, so I'm going to have to say both on that one.
Good for you. Amusement park or a day at the beach?
A day at the beach.
Oh, I love it. Podcast or reading a book?
Reading a book.
Good for you.
I'm old school.
Old school.
Yeah, paper,
all the way.
Like a paper one made out of a tree. Yeah.
Passenger or driver?
Driver.
All right.
I'm not a good passenger.
Laundry or dirty dishes?
I do both.
Good for you.
I'll do them both.
Good for you.
I have to admit, my wife's a great cook, so I tend to be the dishwasher.
Well, you're doing your portion. Business casual or scrubs? I know the answer to this.
I'm not a fan of scrubs. I wear them when I need to. I think people appreciate when people dress a little bit.
I hear you big time. My
I
old mentor said that.
I don't own too many bolo ties, and I don't wear ties anymore because my neck keeps getting bigger. But slacks and a shirt.
Thank you. If you had a choice between 2 superpowers, being invisible or flying, which would you choose?
Oh, I'd fly. Yeah, I think I can't imagine that anybody would give that one up.
I'm with you all the way. And what is the best advice? This can be a little tough, but some people find a quick answer. The best advice you would give your high school self with what you know now?
It's probably the same advice a lot of people would give. Just don't sweat the little stuff.
Oh, I love that.
Things tend to work out, and just calm down a little bit.
Hard to do when we're much younger, isn't that so?
Oh, yeah.
What, finally, is the most interesting thing about you that we wouldn't learn from your resume alone, unless you already told us?
Well, probably the most interesting thing about me is that my wife and I spawned a couple of great kids who I've said it for many years that I live vicariously through my kids, and I want to be them when I grow up.
So there's hope.
Yeah.
All right. Good for you. Thank you for that answer.
You're welcome.
Thank you for tuning in to learn more about Dr. Fogel. For more information on all the services and specialties offered at Community Memorial Health System, visit cmhshealth.org and be sure to like and subscribe for more from your community health system. Thank you, Tom.
Pleasure.